My name is Carol Kaufman from the Centers for American Indian, Alaska Native Health. I've been working with this community for over 15 years now, and we are very limited in time, so if you want to know more about me, you have to ask me later. Okay, so some basics about this population in Colorado. The bottom line here is that there aren't a ton. Okay, this is a population that's very small. Nationally, it's about 2% of the population, and very close to that here in Colorado, a little less. You'll see I have a couple of different levels there. Those who say they are American Indian, Alaska Native only, and then those who choose more than one race, which you can do now in most federal data collection efforts. Unlike most other race groups, this group is often more than one race. And what happens is that now they're getting swept off into that multiple race group. So you don't see half the population in many of the statistics that you might look at, assuming you can even find them in the first place, because often the numbers are so small, you can't report reliably on what's going on. I'm going to just briefly go through this. These are national level indicators. My colleague at the next panel, Crystal Loudhawk-Hedgepeth, will do more on the Colorado level. But it's really just to give you a look at the general disparities that are going on with this group. It's a pretty sad picture. Infant mortality rate, second worst in the country. That's considered generally a general indicator of health of a population overall. Then we have chronic diseases among the worst for these particular diseases, and pretty severe mental health issues going on for this population. So really over the gamut, there are some issues here. Part of what we were supposed to talk about was the causes, and this is really hard to do in 7 minutes, right? But the really important point here for this population, I think, is a historical context. This is what sets the frame for this population and these particular patterns of illness and disease, right? We can start with early genocide, with the huge movement of populations like from the southeast of the country into Oklahoma. That's an artistic rendering of the Trail of Tears, where thousands died along the way. That map is the yellow is the original Treaty of Laramie boundaries for the Great Sioux Nation. The darkest pieces are what's left of that original promise. During the reservation period, we had boarding schools. This is not Exeter. Okay, these were schools where kids were taken from their homes, forced into schools where they were prohibited from speaking their own language. They were prohibited from practicing cultural traditions and any kind of spiritual religious practice. If you want to talk about religious freedom, in fact, for this community, it didn't happen until the 1970s. Okay, but as a result of that, there's this lost generation, that there is no parenting skills transmitted across generations. This was a huge amount of the population. This wasn't just a handful of folks who went off to schools. This was a systematic move to assimilate and otherwise try to get rid of this population. It didn't work, right? Later on, in the 50s and 60s, there are these massive relocation programs. Again, the purpose is to try and get them out of the reservation so the problem would just go away, right? Well, there was a huge movement into cities. The whole assimilation process didn't work so well. There's every indication that health for American Indian, Alaska natives in urban areas are as bad, if not worse, than in tribal settings. So all of this historical context, coupled with this kind of legal framework for tribal communities. So tribal nations are sovereign nations, right? They are a nation. They have a nation-to-nation relationship with the government. They're not necessarily part of the state system, the state legal framework. That, of course, causes a lot of friction and a lot of tension. There's also this assumption that they should just kind of get over it and do what the rest of us do. But there is a whole framework of laws and regulations. And in addition, the treaties guaranteed them a set of benefits: education, health, housing, food. Those treaties don't just disappear. They're not time delimited. They don't run out after a decade or even 100 years. They're the land of the law under the Constitution. Okay? Those treaty rights haven't worked out so well, right? There has not been one treaty that has not been broken. All right. So that historical framework really feeds into this whole determinants of health, right? It is the frame for what a lot of us would look at as almost cross-sectional, right? They're among the most poorly educated. They're among the most poor. They live in areas where there's not much food, not much healthy food, in places where physical activity is really tough to come by. So that's another part of the social determinants of health, the causes, that historical influence presenting the social determinants of health. And finally, I'm going to show you this, kind of getting at those who are more into the medical care setting. This is a figure that shows federal spending per capita, per person, across the different systems of health care. And what this tells you is that the Indian Health Service per capita receives less money than that for federal prisoners. Okay, and it's probably, you'll see that the prisoner data is 2007. It's probably worse now, right? So it's a very sad statement on the value of not only this population and their health, but about what we see as upholding the law of the land in treaties. So I'm going to stop there. I think I'm in my, but it's really depressing to stop there. So on this slide, just a sec. On this slide, I wanted to, these are logos of different projects that my colleagues and I have been engaged in over the years. And we have made a very strong effort to have community engaged research so that the priorities of the community can come forward and we can learn specific things about this population that is usually ignored in research. And we're very collaborative, that it takes more than just one academic sitting in a silo someplace to figure this out. It's really about engagement and working together. So thank you.